Uh, Today I wanted to talk to you about health. Now there are a nice little topic. Uh, there are five key foundational aspects to good health, and they kind of dictate life as well, really. So the first one we look at is motion. Then we've got diet, nutrition, what goes in. Thirdly, breathing. Fourth is lifestyle, what we do, what goes on in our lives, our choices. And the fifth, and a pretty key one, is our feelings, our thoughts, our emotions. Um, what I want to touch on with you today is movement. So what is good movement? What is good physical health? Um, it could be anything. Is that jumping? Is that I can run really fast? Is that I've got big ripped muscles and my biceps are bulging? Is it that I can lift this huge weight? Is it that I can swim the English Channel? What is good movement? I think we can go a lot deeper than that. And I think it's an aspect of the fitness industry that is crucially missing. How many people out there have said, you know what, I want to get fit and healthy. I've signed up for London Marathon. Whoa! We can go a lot further down that. We can look at the foundations of what good physical health is. And what we can look at is not necessarily what we're doing. And this applies to everybody. Whether you're an elite athlete, whether you're a newbie, whether you're spend all your day at a desk, whether you're a skilled labourer, whether you're a fireman, or a firewoman, a nurse, any of these kind of things. What we can look at is not what we do, but how we do it. So how are we moving? Not so much what we're doing, but how are we doing it? And there's probably I reckon about 4 or 5 foundational skills in the way we move that dictate everything. So if you got everything, if you looked at a game of football, if you watched a mum and dad playing with their child, if you watched like firemen or firewomen doing their job, if you watched what they do, you could break it down into pretty much 4 or 5 different things. Are they bending down? Are they standing up? Are they squatting? Are they pushing or pulling? Or are they twisting? So you can break it down into like a handful of skills that dictate pretty much the foundation for everything we do. So what would the quality of what we do be like if we got really good at each one of those key skills? Well, it's going to have a complete correlating effect on it, isn't it? If we really mastered each one of those skills without even stepping near a gym or anything like that, you can do it on your own at home. You could be in your sitting room. If we got really good at those individual skills, and then you can start loading them, whether you're at the gym or applying them to your daily activities or your job or your lifestyle. So getting really proficient at how you move, how you're able to load your body, how you're able to get in a nice stable position, what areas of your body are loading, what areas don't need to be loading, what you can de-stress, and applying those to what you do. For example, if you're a mum or dad getting your child, getting your baby out of the cot, or putting them into the car, getting shopping out of the car, or getting something out of the back of the garage or down from the loft, or have you ever tried shifting a mattress up some stairs? It's like lifting a body. But how do we do that? How can we load ourselves in such a way that we can be in the best physical position we can be, in the way we move, the way we stand, the way we spread our center of gravity, to be able to do these things really well? And it's not an aspect of strength. It's not about an aspect of strength. It's how we move, not what we do. So, and this applies to everybody. Like I said, if you're a parent or it's part of your job, or it might be offsetting the effects of aging as we get out. How many people go into doctor surgeries or in hospital after falls. So we can bandage people up, fix bones and joints and send them back out. Or what if we got people, at whatever age you're at, to understand those principal foundation skills of how to move? What does it feel like to stand in a really nice strong position? What does it feel like to be able to push something with that strong foundation? So surely, looking at an aging population, if they had these skills as they aged, I'm not saying these things aren't going to happen, but you're going to be in a far better position to minimize the chance of them happening. If you have a stumble, instead of falling, you can catch yourself. Or applying it to work. What about nurses who are having to lift patients all the time? Being able to apply these principal skills, these handful of skills to what you do, means that naturally the more you implement these movements, naturally because you're implementing them, they become more of more habitual. You start using them more and more. So in that way you're in a stronger position. I'm not saying you are stronger, but you're in a stronger position to be able to do them. Half the people that go to physios, probably more, osteopaths, all these kind of things, they're kept nice and busy from people who have referred pain. Back pain, my hips hurt, shoulders, neck. How much of that is from, of course it's from lifestyle and things like that. Obviously parts of it could be genetic or wear and tear, but if we're in a better position in the way we move, if we could move much better, would that minimize the chance of having those referral pains, minimizing back problems? Instead of sitting at a desk or in your car with your neck forward, what if we just aligned ourselves, thinking about our posture, our stance? So how we move and how we stand, how we position ourselves, for me, that's like the grassroots of everything. That's the foundation of everything we do. Whatever your lifestyle, whatever your job, whatever your daily requirements and tasks are. It might be, like I said, playing with your children. It might be out in the veg patch, digging up your carrots. It could be applied to everything. So it's got nothing to do with fitness, really. This is kind of the precursor to fitness. This is putting yourself in the very best position to be able to then go out and get fit for whatever it is you want to do. I want to get fitter at playing with my kids, or I want to feel fitter for my job, or I just want to feel healthier because I sit down at my desk all day and I feel rubbish. So what can we do, change to our life that principally and profoundly affect the rest of our life and everything we do? And these are skills that, it's a bit like riding a bike. Once you've learned to ride a bike, you never forget. If I haven't been on a bike for 10 years, you can jump on it and you might wobble for the first 10 seconds, but you'll be straight back on it. So these are skills, once you learn them, once you learn how to move, it never leaves you. And it's a matter of being consistent and using those skills. It's like using anything. If you don't use it, you kind of lose the ability to use it, but you never lose the feeling of what it feels like to move well. So before we think about getting fit, getting stronger, I'm going to go to the gym, I'm going to do all these things, maybe before we think about any of these things, we need to think about how we're moving rather than what we're doing to offset injury and pain and fatigue, to compensate the demands of our job or our lifestyle, or how about, like, what if you're a mum to be and you sort of found out you're pregnant and you're about to, in 9 months' time, you're going to give birth, one of the most amazing events of your whole life. That's a pretty demanding thing. Majority of labour times are longer than a marathon. But how long would someone train for a marathon? A marathon might be sort of anything, 4, 5, 6 hours, maybe around those kind of times. Someone would train for that for maybe a year. And how many hours a week would they put into that training? quite a few, the mileage and all those kind of things. So how is pregnancy and labour and the vigours of being a parent after that, how are they any different? They're more demanding, surely. But how much time do we actually put into that? And the type of training we do for our pregnancy, what kind of training is that? Is that there's some great pregnancy CrossFit classes out there, or pregnancy yoga, all those kind of things, brilliant. But in so many classes, and this is not getting away, there's some amazing instructors out there and coaches, brilliant. But very rarely is focus placed on how we move. A majority of the time the focus is on what we're doing. So perhaps we need to spend a little bit more time thinking about how we're moving, how we're bending, how we're standing. I want to do this particular task. So what position am I going to get in to be able to do that? So maybe we need to spend a bit more time thinking about those aspects, this foundation of good health, of good movement, to be able to then go right back to the beginning. It doesn't, like I said, it doesn't matter if you're a physical elite or someone new to physical exercise and things like that. It's essential for everybody. And then skill by skill, brick by brick, layer by layer, you're adding to that skills, that knowledge base that you have about what it feels like, what good movement really is. And I think if we spend a bit more time concentrating and not missing out those fundamental aspects of what it is to move well, then it's going to directly correlate to how we move on to getting fitter, getting stronger. And like I said, these skills will last you for the rest of your life. And surely that's what's most important. Like building muscle and things like that, it's great. We all want to look good. But month to month, year to year, those things fluctuate. You can lose it, you can get it back, weight goes up and down. But how we move can be exactly the same. You could be someone who's desperately looking to lose weight, but you could be someone who moves like 100 times better than someone who might be really slender. So actually weight and things like that, obviously low, can have different effects on joints, but has no correlation to actually your knowledge base and skills on how to move really well. So the point is this: when you think about your physical health, make sure you don't neglect that foundation of what good physical health is, and that's having this solid foundation of how you're moving. It's like, you don't build your beautiful £1 million mansion on a mud flat, do you? You build it on something solid that you know is going to last for 10, 20, 30, 100 years. You're investing in the quality of what you're doing and how you're doing it and how it feels. And the correlation to that is emotional as well, because the stronger your foundation is, the better you're able to move forward with quality movement. So it transfers to what you're able to do, how hard you're able to do it. So emotionally, you become much more fulfilled by being able to work harder because you've got this solid structure. So your endorphins are better, oxytocin's pumping around you, all those good hormones. So it starts to repair you, but you feel good, so you want to keep going. And you're able to have a better understanding of what it feels like to move well, and so you have a better understanding of connection with your body. So you can tell, I think I pushed it a little bit hard, so I think tomorrow I'm gonna have a little bit of a rest day. And so you have a better understanding, connection with your body, and that's what it's all about, being able to listen to your body and better understand it. So like I said, the takeaway lesson from me today is make sure you spend as much time as you need to. I'm not saying don't do the other things, brilliant, do lots of stuff, but also make sure you give yourself enough time to concentrate on actually the foundation of what movement is, which is how you're moving. If you've got any questions, if you've got any further thoughts or queries about what foundational movement means, please fire off an email to me, send me your comments, and I'd love to hear from you, and I'll answer anything I can. Until then, have a great day, and I'll talk to you soon. Thanks. Hello.